So how do we know if our coronary arteries are open or if they're clogged? That's the essence of this question, which was on my Ozzy Osbourne video, and we were talking about the cause of death being heart attack, and shouldn't doctors have known that he had coronary artery issues? I'm Dr. Wolfe, and if you like content related to forensics, medicine, pathology, true crime, any of that stuff, please consider giving me a follow or go over to my YouTube and follow Knife After Death. So the first thing I'll say about this is that he's a 76-year-old male with a long history, when he was younger, of pretty serious substance abuse. And so regardless of that, being 76 years old, there's going to be some degree of coronary artery disease. I think I've only seen a handful of people over 80, 75 or 80 who had completely clear coronary arteries. Usually there's a little bit. So it's reasonable to assume his doctors knew he had some coronary artery disease. The second thing I'll say is that you can't look at somebody physically and know what their coronary arteries look like. I can tell you as a person who's done over 3,000 autopsies that sometimes very large, morbidly obese people who don't exercise or do anything will have completely clear and clean coronary arteries. And younger people who are in their 30s and 40s and work out every day will have terrible coronary arteries. Now, that's not a rule, but that is something that I see. Most 30 and 40-year-olds who work out don't have clogged coronary arteries. So don't worry about that. But the point is, you can't look at somebody physically and then immediately say they have bad coronary arteries. So in other words, in the case of Ozzy, his doctors wouldn't have looked at him and said, aha, there's an impending heart attack just by looking at him. So now we're talking about how do we actually find out. You'll see people talk about heart scans where you can go to the hospital and they're $50 or $100 and they scan just the heart. But that's looking for calcium. And not all coronary artery disease is calcified. It tends to calcify as you get older. Almost all the folks I see in their 70s have 60s and 70s have some calcium, and that picks up on that scan. However, that's the hard calcified plaque. There's also plaque that's soft and uncalcified, and those won't show up on heart scans. And the definitive test for whether or not you have clogged coronary arteries would be a coronary angiogram, where they actually will go in usually through the groin, and they put a catheter and they inject dye, and they look for strictures within the coronary arteries. And that's not something that's just a regular test you can get from your doctor. You can't just go in and say, I want a coronary angiogram. You usually have to have a reason for that, usually presenting to the ER with chest pain, or you've come to your doctor with increasing shortness of breath on exercise, going upstairs and things like that. So in the absence of that kind of testing, then you have to rely on things like symptoms. So, for instance, shortness of breath walking upstairs. Now, we all are going to have a little bit of shortness of breath if we do a bunch of stairs, but I'm talking about like a couple of stairs going up to your house, walking from the living room to the bathroom, that sort of thing. When you have shortness of breath, you have to start wondering about cardiac function. Likewise, any chest pain associated with activity would also give an indication that perhaps coronary blood flow is not that good. And then there's also lab data. For instance, lipid panels that people get every year when they go to the doctor and they see what their cholesterol levels are. And I'm going to preempt this by saying that you'll have people immediately, they're typing right now, cholesterol doesn't matter, cholesterol is healthy, we should have as much cholesterol as possible, because I saw a YouTube video or a podcast where they said cholesterol makes up the brain. Yeah, that's true. Cholesterol is important in cell wall formation. There is no question about that. We have to have cholesterol in our bodies. But just like anything, too much is bad, okay? Too little or too much of anything is bad. So, potassium, a potassium of 5.5 is pretty much on the upper level of normal. But if you go to 6.8, now you may be getting into cardiac arrhythmia and death territory. Likewise, something as simple as water. Too much water in a short amount of time can actually kill you with water toxicity. So the point I'm making is that, you can't immediately say that, all people should have as much cholesterol as possible because it forms our cell walls. You can look at lab data, and if you see somebody who has a cholesterol that's high, an LDL that's high, you can perhaps infer that there could be some coronary artery disease, but it's true that they might not. Likewise, people with normal lipid panels may have some coronary artery disease. And I realize this is a very long and drawn out discussion, but you have to understand this is a very complex topic, and it kind of gets at the root of why heart disease is the biggest killer of Americans, right? Because if it was something we could detect easily and treat easily, then it wouldn't be the biggest killer of Americans. And not just America, but worldwide. I happen to be in America, so my patient population is American. So one other thing I would add is family history. If you have a long family history of everyone having heart attacks, I think it could be reasonable to assume that you might have some kind of genetic component of lipid deposition where you're going to develop atherosclerosis more quickly. And also you have to remember just social history. I mean, there are certain things, for instance, most of the young heart attacks I see are people who smoke because chemicals in smoking, in tobacco smoke, will damage the endothelial lining of blood vessels, which then causes the deposition of cholesterol, and that's obviously going to be bad. So other things, recreational substances that are white and powdery and often cause increased heart rate and awareness, those things are very bad. Also see that in my younger patients who I have to deal with, because anything that damages blood vessels, and that doesn't just go for substances, but viruses and anything that damages blood vessels is a very bad thing for your body. So sorry for the long video. I imagine most of you didn't listen to the end, and that's okay, because people don't watch TikTok for 7-minute videos about atherosclerosis, which is why I will put this on my YouTube as well so other people can learn. But it is a very complex topic, and I could talk about it for hours. This is a very, very short version of what I would like to talk about.